Hello, hi. For those of you who are joining us today, this is Florida Spine and Pain, and today we are excited to feature a patient educational webinar. Today we are going to be featuring Abbott in some of the solutions that we work with them. We work with a multiple array of pain management treatment solutions. We do medication management, but we really try to focus on alternative treatments for long-term chronic pain relief. So I'm happy to announce Tiffany Brown. She's a clinical specialist for Abbott. And the great thing about our relationship with them is that they follow the patient before the procedure. They help the patient with the authorization with the insurance. They are inside the hospital room or the outpatient clinic room with them, guiding them with the physician and making them feel comfortable. And they do the follow-up with the physician for post-treatment follow-up care. So, Tiffany, please take it from here.
Okay. Thank you for the introduction, Michelle. So I'll go ahead and just jump right in, and we will go ahead and discuss treatments for chronic pain management. Our agenda will consist of chronic pain and its management, neurostimulation therapy, steps to getting neurostimulation therapy, and then I'll be sure to review our care team and our resources so that if you have any questions or would like any additional information at the end, then you can reach out to us directly. So, living with chronic pain, there are several facts surrounding chronic pain and the treatment of chronic pain, but one that specifically stood out to me is that chronic pain affects more Americans than diabetes, heart disease, and cancer combined. That's an astounding fact. What is pain? So, pain is the body's natural response to harm or possible damage. It typically occurs when special nerve endings called pain receptors trigger a signal that travels up the spinal cord to the brain. And then these signals can be released in response to illness, injury, or chemical changes within the body. How does chronic pain differ? Typically, it'll last longer than 6 months or longer than would generally be expected for recovery from a specific disease. Sensation varies from person to person, and the source of pain may be unknown. The symptoms can consist of burning, headaches, stabbing, dull aches or discomfort, or tenderness. There are different tiers for treating chronic pain. Typically, in the first tier, you may have cognitive and behavioral therapy. You may be treated with NSAIDs or medications, sometimes physical therapy, TENS units, and as I said, over-the-counter or pain medications. Second tier can consist of opioids or nerve blocks and injections. And then in the third tier is when we really get into radiofrequency ablation or implantable drug pumps, and then neural stimulation, which would consist of spinal cord stimulation therapy. Typically, that would be recommended when the other treatment options may have failed. So jumping right into neural stimulation and spinal cord stimulation therapy, also known as SCS. So for neural stimulation therapy, SCS is a well-established therapy recommended by doctors for more than 50 years. So that is a common question, is how long has it been around? And the answer is more than 50 years. Uses mild electrical pulses to change the pain signals as they travel from the spinal cord to the brain. And this may be used to help to reduce pain to a manageable level and to return to a more normal lifestyle. So steps to getting an SCS therapy. Typically, you would be evaluated by your pain management specialist to ensure that you would be a good candidate for this type of therapy. And if so, again, your doctor will determine if you're a candidate. A representative will reach out to you to go over the trial period and to answer any questions and provide education on the treatment as needed. So we have a care card here, but if you'd like, you could always reach out directly to Florida Spine and Pain if you have any questions regarding a spinal cord stimulator trial and provide your information to the team there, and they can let the care team reps know that we can reach out to you. So now jumping into a trial, there is a trial period that is associated with spinal cord stimulation therapy. Typically, the trial period would last about 5 to 7 days. During the trial, you'll see how well the therapy controls your pain before committing to an implanted system. During the trial, you can assess whether the therapy provides meaningful relief, improves your ability to perform daily activities, and improves your sleeping habits. So during the trial, you will have temporary leads placed typically around the mid-back area. And as you can see here on the screen, there's an example of the temporary leads. I also have an example of it here. So there's 8 contacts on this lead placed typically towards the middle of the back. There is an external battery that is then attached to the opposite end of those leads. Everything is taped down to you, which, as stated before, will be worn for about 5 to 7 days. There is a patient controller that is also provided throughout the trial, which will allow for the increase or decrease of stimulation or moving in between different programs as needed. So as mentioned, a short procedure will be performed, which is typically done in the doctor's office or in a same-day surgery center, or can also be done in a hospital setting. And again, those leads are placed, that battery's attached, and then we take you through that 5 to 7 day trial period. Every day of the trial, you will be contacted by a representative checking in to see how everything's going and to ensure that the desired pain relief is being reached. After that is said and done, you would then come back into the office and we would discuss as a team how well you did during your trial. If you did well and you're looking to move forward with an implant, then we would discuss with the physician on the next steps on getting an implantable system. Your physician you and your team will discuss any possible complications or restrictions, certain activities that needs to be restricted. And in general, you should be able to perform your daily activities with less pain over time. So here is the information for the care team. Vanessa Milek, myself, Tiffany Brown, and Taylor Banis is available to provide any additional information on spinal cord stimulator trials and just any education or any questions that you may have regarding the trials. And then, of course, there would be questions and answers. Again, you could reach out to us directly with those questions, and we will certainly get those answered for you. And that concludes our presentation today. We're looking forward to hearing from you with any additional questions, and have a great day. Thank you.
Thank you, Tiffany. In summary, I think what we love to hear is, the answer to the main question, which is how cumbersome is this trial period, right? People usually are concerned about having some implanted device. If you can show the lead again so that people can see how minimal it is.
Absolutely.
And that this is a trial period, right?
Yes.
So what we're trying to gauge is whether this works for you. It's like turning down the volume in pain is how some patients refer to it.
Absolutely.
So I am going to list, our resources for our office number, our website, and some patient testimonials, which are wonderful to hear how great this solution works for them. So
Awesome.
Thank you so much for coming today and explaining further how spinal cord stimulations work. We will be having future patient education seminars on other solutions, so stay tuned for those. And once again, Tiffany, thank you so much for being with us today.
You're welcome. Thank you so much for having me. You have a great day.
You too.